Kris from Memorial Sloan Kettering, continuing a discussion about antibody-drug conjugates, ADCs. And in this case, Dato-Potamab Deruxtecan, Dato-DXd. This agent combines a anti-TROP2 antibody with a potent topo-1 inhibitor, and it has had activity in a number of diseases, and the topic today is lung cancer. There has been a phase 3 randomized trial already. It's shown, compared to docetaxel, and improved rate of response by about 10 or so percent. It showed a small improvement in disease-free survival and about a 1-month improvement in overall survival over docetaxel. I think what this trial shows, it clearly is an active agent, and I think it's useful to us for adenocarcinoma patients, giving us an additional line of therapy. And it would be a real judgment call whether when a patient needs a new line of therapy, whether to give docetaxel first or the Dato-DXd first. The drug is not yet approved for lung cancer, but it is obviously in the approval process now. The other thing noted in that phase 3 trial was there was very limited activity, and in fact, less activity than docetaxel in patients with squamous cell cancers. So clearly that activity is largely limited to the adenocarcinoma patients, and I think that's where, if approved, it will finally be useful. The other companion paper in the Journal of Clinical Oncology is using Dato-DXd in patients whose tumors have oncogenic drivers. And what they found was there is a higher than expected response rate. It was in the 20s in an unselected population, but in the EGFR patients, it was 36%, and in the ALK patients with ALK rearrangements in their tumors, it was 44%. I think this may be the place where it will be most useful. Again, in 2025, we still don't have a therapy beyond standard chemotherapy after progression on osimertinib, and this may be a useful drug in that place. Again, useful in adenocarcinoma. To summarize, Dato-DXd, a drug in the regulatory approval process, clearly has activity in a unselected population of adenocarcinoma patients. It's roughly comparable and slightly better than docetaxel, less effective than docetaxel in a squamous population, but in addition has, at least in other trials, has some activity and perhaps even more activity in patients with drivers like EGFR or ALK, so it may have usefulness there. I think we're fortunate to have more new agents. We're fortunate to be able to make more choices to match drugs and side effects to specific patient characteristics and specific patient preferences. And once again, our job is better, but it's hard. And clearly, the harder we work, the better we're going to make the course of illness for our patients.